So Cymbalta was first approved for medical use in the United States in 2004, and by 2018, it was the 36th most commonly prescribed medication in the United States, with more than 21 million prescriptions. Welcome back, Straight Talkers. Today I'm going to talk about the medication Cymbalta so that you can be better informed when deciding whether or not to start this medication. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. So Duloxetine is a generic name and Cymbalta is the brand name. So how does this medication work? Cymbalta is considered to be a serotonin norepinephrine reuptake inhibitor, or SNRI for short, and it works by increasing the amounts of serotonin and norepinephrine in certain parts of the brain. In adults, Cymbalta is FDA approved for the treatment of major depressive disorder, generalized anxiety disorder, diabetic peripheral neuropathic pain, fibromyalgia, and chronic musculoskeletal pain. And this includes things such as osteoarthritis or chronic low back pain. It's also FDA approved for the treatment of generalized anxiety disorder in kids 7 and older, and it's often used off-label to treat several other conditions, including neuropathic or chronic pain disorders, other anxiety disorders, and stress urinary incontinence. Cymbalta comes in delayed release capsules, and dosing is generally between 30 and 120 milligrams daily. Most people will take this medication once daily, but some people will also do split dosing. Generally, if I'm using this medication in kids, I'll often start at an even lower dose to help reduce the risk of potential side effects. And my approach is generally always to start low, go slow, meaning that we start at a low dose and increase the dose gradually and slowly over time with the goal of finding the lowest effective dose. Once this medication is started, it usually takes a couple weeks before you start noticing a difference, and in many people, it'll take a whole 1 to 2 months before it reaches its full effect at the prescribed dose. And because of this delay, I typically recommend starting therapy during this time because the benefits of therapy can be seen right away. And the goal of treatment with this medication is complete remission of current symptoms, as well as the prevention of future episodes. Now let's talk about the potential side effects. It's important to realize that many side effects are often considered to be dose dependent, meaning that the likelihood of getting them increases as the dose increases. Some are also time dependent, meaning that they begin immediately upon starting the medication or whenever we make a change in the dosing of it. But what we typically see is that side effects will go away with time as the body gets adjusted to the medication. The common but usually more mild side effects of Cymbalta can include things such as nausea, headaches, dry mouth, fatigue, insomnia, dizziness, constipation or diarrhea, decreased appetite, and excessive sweating. More serious but less common side effects could include increased suicidal thoughts or actions in those under the age of 25 years old, serotonin syndrome, increased chances of bleeding, manic episodes, liver damage, and seizures. When someone is put on Cymbalta, it's ultimately unknown exactly how long they'll need to be on it, but research suggests that once someone's symptoms return to baseline and they're back to feeling like normal, they should continue the medication at the current dose for another 6 to 12 months. And what this does is it helps prevent relapse or recurrence of symptoms. When deciding to come off of Cymbalta, please do not stop taking this medication without talking to your doctor first. And this medication does have a higher risk of discontinuation symptoms if the medication is stopped too quickly. Symptoms can include dizziness, headaches, paresthesias, fatigue, vomiting, irritability, insomnia, diarrhea, anxiety, and excessive sweating. So make sure to let your doctor know if these symptoms start to occur when you try to come off the medication, because there's different approaches that we can take to reduce these unwanted effects. Now head on over to the next video to find out more ways that you can help your child live their best life.